A silent cancer that hardly shows any signs, does not appear in tests, and has doubled the number of cases in recent years. And even worse, it has been affecting younger and younger people and is fatal in 90% of cases. How can you protect yourself from this tumor that has become a real epidemic? Hello family, welcome to another video here on our channel. Pancreatic cancer is almost always fatal. When you feel any symptoms, it is usually already too late. Why is there this increase in the number of pancreatic cancer cases, especially among young people in their 30s and 40s? Could it be genetic? What tests can detect the tumor early? What are the symptoms? Extreme fatigue is one of them. So, if you are always tired, watch this video until the end, because today I will show you how to protect yourself from pancreatic cancer. That is why you should go ahead and leave your thumbs up, your like on this video. Do not forget to share it in your groups and tell me something. Have you been doing your annual checkup properly? Or do you just check blood count, cholesterol, and glucose? Tell me in the comments below. My friends, do not forget to visit my website. My website lists all the supplements I use, recommend, and that you are always asking about. Moacir, what is the best magnesium? What is the right dose of vitamin D? What is the best omega-3? It is all there on my list of supplements on my website. My courses are there too. My other social media is www.darmoacir.com.br, or even easier. Go to Google, type Moacir Rosa, and you will find my website. Pancreatic cancer is the fastest growing in the world according to the global burden of disease. The number of cases has doubled in the last 30 years and has increased mainly among young people. People aged 25, 30, and 40 at their prime. Why is this happening, Moacir? Well, first, I want to say that pancreatic cancer is so dangerous and so deadly because it does not show any signs or symptoms. When a person feels any pain or any sign, we will talk about the main signs here during this video. Let's see. Usually, in 90% of cases, it is already too late. The person is already in metastasis, and then treatment becomes very complicated. And even worse, it does not show up in routine exams. Many times, the person already has pancreatic cancer, does the routine exams, and nothing shows up. It is like the person has nothing. We are also going to talk here about the specific exams for this type of cancer. So, it is very important for you to take the precautions I'm going to mention here, and especially if you have a genetic predisposition to develop this type of cancer. That is the first major factor, okay? This cancer has a very strong genetic factor, so if you have certain types of genes, especially BRCA2, okay? BRCA2 is a gene that is inherited from the mother. If you have this gene present in your DNA, you have a higher chance of developing pancreatic cancer. It does not mean that you will develop it, but if you have this gene, you need to be much more careful. I am going to talk about the precautions here, but how will I know, Moacir, if I have this gene? You need to take a genetic test, okay? You can also see if your family has any cases. If a relative like your uncle, mother, brother, or grandparent had pancreatic cancer, that is a warning sign, right? If someone in your family has had pancreatic cancer, there is a high possibility that you have the BRCA2, but that is an inherited gene. It accounts for only 10% of pancreatic cancer cases. The other 90% of cases are different. It has to do with the mutation of the KRAS gene, okay? The KRAS gene is responsible for turning cell growth on and off. It has its physiological importance. Except that when it undergoes a mutation, its cell growth shutdown system is deactivated. So it promotes uncontrolled proliferation, and that is where cancer comes in. How does the KRAS gene mutation occur? That is where the risk factors come in. What are they? You probably already know. Tobacco and alcohol. If you smoke and if you abuse alcohol, your chances of causing a mutation in the KRAS gene, developing pancreatic cancer, is higher than for those who do not smoke and do not drink. If your diet is based on ultra-processed, industrialized foods, which are inflammatory, it also increases your chance of causing a mutation in the CRAS gene. Notice that the mutation in the CRAS gene is related to inflammation. The more inflamed you are, an inflammatory environment causes this mutation. So tobacco is inflammatory, alcohol is inflammatory, an inflammatory diet based on ultra-processed and industrialized foods is inflammatory. You have other factors like the excess of pesticides that we are exposed to nowadays. And a very important factor, excess insulin. If your insulin is very high, the first test you need to pay attention to is your basal insulin levels. The ideal insulin level, my friends, is to be below 5, below 5. If you have very high insulin, it means your pancreas is working very aggressively. So this also causes an inflammatory process. Those with very high insulin may develop pancreatic failure and later diabetes. So, if you are diabetic, if you are pre-diabetic, if you have high insulin, your chances of developing this type of tumor are also high. How to prevent this? Reduce carbohydrates. Carbohydrates, my friends, it is all bad. You gain weight, develop diabetes, increase your risk of high blood pressure, increase your risk of heart attack, and you will also increase your risk of pancreatic cancer. DNA errors. This is very common. Our DNA sometimes makes mistakes during transcription, so these transcription errors can also lead to mutations in the pancreas. But how can you avoid this? Good levels of vitamin D. Vitamin D is a hormone that is mistakenly called a vitamin, and it helps with maintenance, control, and corrects these errors in DNA. That is why people who have vitamin D levels above 60 nanograms per deciliter are healthier, less likely to develop cancer, and have a stronger immune system. They do not have problems, or it prolongs things, right? It delays issues like osteoporosis, boosts energy, and improves sleep. Then there is vitamin D. We have videos here that talk specifically about it. So good levels of vitamin D help fight and control this DNA that is replicated incorrectly. So notice that everything we talk about here as a risk factor, risk, are things you already know and that you should avoid at all costs. Well then, what about the signs? For someone who has this type of cancer, what are the main signs, the main symptoms? First, there is abdominal pain, usually diffuse, generally in the upper part of the abdomen right here, which can radiate to the back. A lot of people discover pancreatic cancer thinking they have a back problem. So when you have this pain, fly to the doctor. And also jaundice. It is very common to have yellowish skin, yellowish eyes, unexplained weight loss or loss of appetite. Suddenly you lose your appetite and start losing weight. Watch these signs closely. Light-colored and greasy stools, which is steatorrhea, right? Those stools look fatty. That is why, interestingly, it is always good, after using the bathroom, my friends, to check the shape of your stools, how they look, what color they are. If anything changes, something is wrong. And a classic symptom, suddenly developing diabetes, all of a sudden the person becomes diabetic out of nowhere. They were not pre-diabetic, they are not overweight, and there is no history, not even in the family history. Suddenly the person becomes diabetic. It could be due to a tumor in your pancreas. After all, it is the pancreas that produces insulin. But, my friends, when a person has these signs, when a person has these symptoms, as I said, in 90% of cases, it is already too late. So how can you prevent this more effectively to keep it from happening? Well, first check if you do not have this gene. Get a genetic test. Yes, it is not accessible to everyone, but I have to share this information. If you have the gene, it is important for you to pay more attention to all these factors I just mentioned to you. Insulin. Keep insulin under 5. Levels of 12, 13, 15, or 20 are too high. Besides contributing to the development of diabetes, it can also lead to other problems with your pancreas. The pancreas, my friends, is like a hidden powerhouse, When it gets overloaded, it will fail, and it will fail silently. When the symptoms appear, as I said, it is usually too late. Some specific tests, okay? Whenever you get a blood test, it is important to ask for the CA19, okay? It is a tumor marker. It is not very specific, but it already helps. If you had a high carbohydrate antigen 19, you can investigate some type of tumor because it is an interesting marker. I always recommend that you include the carbohydrate antigen 19 test in your blood work. The abdominal ultrasound is an initial exam. It is not that specific. It does not mean you will identify it early, but it is an accessible exam, right? Anyone can get it done at a health clinic. You can do it there. SUS does the abdominal ultrasound. It is already a way for you to prevent yourself. The ideal thing is actually a computed tomography scan or a magnetic resonance imaging, because then you get a better definition of the organ, so you will get a magnetic resonance imaging and evaluate it there. In this case, it is important, if you have family history or these risk factors, to get a computed tomography scan or magnetic resonance imaging more frequently, okay? Endoscopic ultrasound also has a high sensitivity. But the most important thing, my friends, is to avoid the risk factors. If you smoke, stop smoking. If you are drinking too much alcohol, cut back. If you are eating too many ultra-processed foods, reduce it and start eating more real food. And if you are overdoing it with carbohydrates, you and bread and but in your heart, in your liver, it will improve your overall health. My friends, my website is www.moacir.com.pr. As I said, on my website, you can find all the supplements I use and recommend. My courses are there, as well as my other social media. I could not find Moacir. Just search Moacir Rosa on Google and you will find me. If you're not subscribed to the channel, my friends, it is free. Just click on subscribe. Do not forget to hit the bell. Do not forget to select all. I hope you enjoyed this video. I hope it was useful for you. Do not forget to share, and I will be waiting for you in our next conversation, my friends. See you then. See you.